This video demonstrates how to do a lumbar puncture or spinal anesthesia. The patient is first checked and confirmed it is the patient who needs this procedure. We will put a IV line, connect the monitors, connect all the fluid and everything, and be ready. And now we will position the patient and start to paint the back after you have worn a sterile gown, gloves, mask, cap. You will now do a rotating type of cleaning of the back, seeing that you don't come back to the center. So always it is from the center and away. Now you will take a sterile drape, so you will cover the area. Then after you cover it, you will start to look for the landmarks. So our landmark is when the patient is sitting, we look for the highest point of the iliac crest. So the two iliac crests, you will make a thumb to cover the iliac crest, and when you come to the center, this is around the L4, L5 space. So you will go one or two spaces above, because the spinal cord ends at the lower border of L1 or upper border of L2. So any spinal or lumbar puncture should be done below it, because otherwise it will injure the spinal cord. So we are now preparing the equipment which has been checked before, and now we are taking a local anesthetic, which is 2% xylocaine, so that the patient will not feel the pain during insertion of the needle. Though the needle is very small, 25 gauge or 27 gauge, depending on the size you want to use it. So this will, the lesser the size, the better. It will reduce the headache. So this is the local infiltration on the skin. Now we will take the introducing needle, which is connected to the thing. He is just giving it deeper into the skin and the subcutaneous tissue. Now this needle has two parts. One is the introducing needle, the other is the spinal needle. So we first insert the introducing needle facing the cephalad direction. So we will have the needle going a little cephalad towards the head. Okay. Now we will take the needle, which is a long 11 centimeter needle, which is a spinal needle with a pencil point. This is very important that you have a pencil point. Once you insert it and remove the stylet, you should see the CSF coming. You will take the drug, or you want to take a sample or whatever from the CSF, you do it. So here it is a spinal anesthesia. We are injecting the drug into the CSF, and that will cause a complete loss of sensation below the umbilicus, and then we thank the patient and remove the drape.